Stop scrolling for one moment. If you wake up tired every single morning, even after a full night of sleep, this video is for you. You might have sleep apnea, and you probably do not know it. Stay with me. This could change your health. Quick but important. This video is for educational purposes only. It is not medical advice, and it is not a diagnosis. Always speak with your doctor or a qualified healthcare professional about your health. If you are having a medical emergency, call 911 or go to your nearest emergency room immediately. Now, let us talk about sleep apnea. Every night while you sleep, your body is supposed to breathe, quietly, steadily, all night long. But for millions of people, that is not what happens. Sleep apnea is a medical condition where your breathing repeatedly stops or slows during sleep. The most common type is called obstructive sleep apnea, or OSA. Here is what happens. As you fall asleep, the muscles at the back of your throat relax. In some people, they relax too much. The airway narrows, or it collapses completely. Air cannot get through. Breathing stops. This pause can last 10 seconds, 20 seconds, sometimes 30 seconds or longer. Then your brain senses danger. It sends an emergency signal. You gasp. Your airway reopens. Breathing restarts, and you have absolutely no memory of it. In moderate or severe cases, this happens dozens of times every hour, all night long. Think about that. Every hour, dozens of times. Your oxygen drops, your heart races, your brain fires an alarm, and then silence again until the next pause. That is sleep apnea, and most people living with it have no idea. So how do you know if you have it? Let us start with what happens at night. Sign 1. Loud, persistent snoring. Not light snoring. Loud snoring. The kind that wakes up other people. The kind that can be heard through walls. Snoring happens when air is forced through a narrowed airway, causing the soft tissues in your throat to vibrate. Most people with sleep apnea snore, and they snore loudly every night. Sign 2. Witnessed breathing pauses. This is the one that often gets noticed first, by a partner, a family member, or a roommate. The pattern goes like this: loud snoring, then sudden silence, no movement, no breathing. A pause that feels alarming, and then a loud gasp or snort, and snoring resumes. If anyone has ever told you that you stopped breathing in your sleep, please take that seriously. That is a clinical red flag. Sign 3. Waking up gasping or choking. Some people wake themselves up mid-episode, heart pounding, gasping for air, feeling like they were suffocating. Many people dismiss this as a nightmare or anxiety. It is not. It is a respiratory event. Sign 4. Restless, broken sleep. Sleep apnea prevents you from ever reaching deep sleep. You cycle through light sleep all night without knowing it. You may spend 8 hours in bed, but your body never truly rested. Sign 5. Getting up to urinate multiple times at night. This one surprises people. How is nighttime urination connected to breathing? When oxygen drops repeatedly during sleep, it triggers hormonal changes that increase urine production. Many people with sleep apnea wake to use the bathroom and never connect it to their breathing. Sign 6. Night sweats. Waking up damp or sweaty without obvious cause. When the body activates its stress response during a breathing pause, it can trigger sweating, even while you are asleep. Now let us talk about what happens during the day. Because sleep apnea does not stay in the bedroom. Excessive daytime sleepiness. You slept, but you are exhausted. You fall asleep in meetings. You struggle to stay awake while driving. You need coffee just to function by 9 a.m. This is not normal tiredness. This is what happens when your body was deprived of oxygen and deep sleep all night. Research shows that sleep apnea significantly increases the risk of car accidents because the impairment is comparable to driving intoxicated. Scene. Graphic on screen. Daytime sleepiness warning. Waking up unrefreshed, 7 or 8 hours in bed, and you wake up feeling like you barely slept. That disconnect between hours and rest is one of the most telling signs of sleep apnea. Morning headaches. Waking up with headaches, especially at the back of the head or temples, is directly linked to overnight oxygen drops and carbon dioxide buildup during apnea events. Brain fog and mood changes, trouble concentrating, forgetting things, feeling irritable, emotional sensitivity, feeling mentally slower than you used to. These are not personality traits, they are symptoms. Long-term untreated sleep apnea has been associated with increased risk of cognitive decline. Your brain needs oxygen, it needs deep sleep. Sleep apnea takes both.
I want to speak directly to the women watching this. Sleep apnea is dramatically underdiagnosed in women, and it is not because women have it less, it is because women present differently. Men typically report loud snoring and witnessed breathing pauses. Women are more likely to report insomnia, chronic fatigue, anxiety, depression, morning headaches, and mood changes. These symptoms overlap with so many other conditions, thyroid problems, perimenopause, depression, that women are often sent home with the wrong diagnosis. After menopause, the risk increases significantly. Estrogen protects the airway. When estrogen drops, that protection disappears. Fat distribution shifts. Airway muscle tone decreases. Breathing instability increases. During pregnancy, fluid retention and hormonal changes can narrow the airway. Sleep apnea in pregnancy is linked to gestational hypertension and gestational diabetes, conditions that affect both mother and baby. Women with PCOS, polycystic ovary syndrome, also carry a higher risk. If you are a woman who is exhausted, struggling with mood, and not sleeping well, do not let anyone tell you it is just stress or hormones without ruling out sleep apnea first.
Sleep apnea can affect anyone, but some people are at higher risk. The strongest risk factors include obesity. Excess fat around the neck and throat directly increases airway collapse during sleep. Even a small amount of weight gain can make it significantly worse. Other risk factors include a large neck circumference, jaw structure differences, high blood pressure, type 2 diabetes, atrial fibrillation, a history of stroke, alcohol use, and smoking. Age matters too. Risk increases after 40. And if you have high blood pressure that is difficult to control, sleep apnea may be contributing. It is one of the most common but least recognized causes of treatment-resistant hypertension. I need to be direct here. Sleep apnea is not just a sleep problem, it is a cardiovascular disease risk factor. Every time your oxygen drops during the night, your body activates a stress response. Blood pressure spikes. Inflammation is triggered. Your blood vessels take damage. Your insulin regulation is disrupted. Night after night, month after month, year after year. Untreated sleep apnea is directly linked to high blood pressure, stroke, coronary artery disease, heart failure, atrial fibrillation, type 2 diabetes, and increased risk of early death. Sleep apnea is a systemic condition. It affects your heart, your brain, and your metabolism. This is not meant to frighten you. It is meant to motivate you, because it is also very treatable. The only way to know for sure is a sleep study, and it is simpler than most people expect. Your doctor may recommend an in-lab polysomnography, where you spend one night in a sleep center while sensors monitor your brain activity, oxygen levels, airflow, heart rhythm, and breathing effort. Or for many people, a home sleep test is now an option. You wear a small device at home in your own bed. It measures your airflow and oxygen levels overnight. Your results will include an AHI score, the Apnea-Hypopnea Index. This tells you how many breathing interruptions you had per hour. 5 to 14 per hour, mild 15 to 29 per hour, moderate 30 or more per hour, severe. The higher the number, the greater the cardiovascular risk. The gold standard treatment for moderate to severe sleep apnea is CPAP, continuous positive airway pressure. A machine delivers gentle pressurized air through a mask while you sleep, keeping your airway open all night. CPAP reduces apnea events, improves daytime alertness, lowers blood pressure, and reduces cardiovascular strain. It works, but you have to use it consistently. For mild to moderate cases, a custom dental appliance that repositions the jaw can be effective. Positional therapy helps people whose apnea occurs mainly when sleeping on their back. For selected patients, a small implanted device called a hypoglossal nerve stimulator keeps the tongue muscle active during sleep, preventing it from blocking the airway. And for everyone, weight loss, avoiding alcohol before bed, quitting smoking, and keeping a consistent sleep schedule all make a meaningful difference. Lifestyle changes support treatment, but they do not replace evaluation. If you have symptoms, get tested first. If you have been waking up tired every day and telling yourself it is just life, please hear this. It might not be just life. It might be your airway collapsing dozens of times every hour while you sleep. Sleep apnea is common. It is often overlooked, and most people who have it do not know. But you do not have to keep living this way. Talk to your doctor. Ask about a sleep study. Ask about sleep apnea specifically. You deserve to breathe well at night. You deserve to wake up rested. You deserve to feel like yourself again. If this video was helpful, please share it. Someone you know may need this information today. Follow CareThrive for more evidence-based health education, and visit us at carethrive.org for free written guides and resources. Take care of yourself, and I will see you in the next video.